Ever wondered how important it is to have control over your family's future? Family planning is not just about deciding the number of children you want, but also about creating a healthy environment for them. It's about striking a balance between the needs of your family and the resources available to you. It's about ensuring the well-being of every member, from the youngest to the oldest. Family planning has far-reaching impacts that extend beyond the nuclear family. It influences the health of a society, its economic stability, and its environmental sustainability. It's a powerful tool for social change and progress. But how do we achieve it? There's no one-size-fits-all answer. Family planning involves a range of strategies, and one of the most critical aspects is controlling the timing of childbirth. This is where various devices and methods come into play. So, let's dive in to understand the different devices used for family planning. Scene script. Family planning devices are tools that help prevent unplanned pregnancies. They can be temporary or permanent, depending on your needs and preferences. Let's delve into the world of family planning devices. Understanding these tools can be a game changer when it comes to controlling your family's size and timing. There are a myriad of options out there, each with its own advantages and considerations. Broadly speaking, these devices fall into four main categories: barrier methods, hormonal methods, intrauterine devices, and sterilization. First up, we have the barrier methods. As the name suggests, these devices work by creating a physical barrier that prevents sperm from reaching the egg. They include condoms, diaphragms, and cervical caps. These are typically used with a spermicide to increase their effectiveness. Next, we move to hormonal methods. These devices use hormones to prevent ovulation, thus preventing pregnancy. They come in various forms, from pills and patches to injections and implants. Each type has its own set of pros and cons, but all aim to offer a reliable method of contraception. Thirdly, let's talk about intrauterine devices, or IUDs. These are small devices, often T-shaped, that are inserted into the uterus. They work either by releasing hormones like progestin or by using copper to create an environment that's inhospitable to sperm. Lastly, there's sterilization. This is a more permanent solution and involves a surgical procedure for both men and women. For women, this is often done through tubal ligation, where the fallopian tubes are sealed off. For men, a vasectomy is performed where the tubes carrying sperm from the testicles are cut or blocked. It's important to remember that the right family planning device for you will depend on a variety of factors, such as your health, frequency of sexual activity, desire for future children, and comfort with use. Always consult with a healthcare professional to make the best decision for your circumstances. In the next few scenes, we will explore each of these devices in detail. Barrier methods, as the name suggests, create a physical barrier to prevent the sperm from reaching the egg. They are among the oldest and most widely used types of contraception worldwide. Let's dive into the most common barrier methods: condoms, diaphragms, and cervical caps. First up, condoms. These are thin sheaths made of latex, polyurethane, or natural materials that are worn on the penis during sexual intercourse. They act as a physical block, preventing sperm from meeting the egg. Condoms have an added advantage of reducing the risk of sexually transmitted infections. However, their effectiveness can be compromised if they tear or slip off during sex. Next, we have the diaphragm. This is a shallow, dome-shaped cup made of silicone. It's inserted into the vagina before sex to cover the cervix, blocking sperm from entering the uterus. Diaphragms must be used with a spermicide, a substance that kills sperm, to be most effective. Some women may find diaphragms difficult to insert, and they can occasionally cause urinary tract infections. Lastly, let's discuss cervical caps. These are similar to diaphragms but smaller and often made of rubber instead of silicone. They also need to be used with a spermicide and inserted over the cervix. Cervical caps can be left in place longer than diaphragms, but they can be harder to fit and may cause irritation or abnormal pap smears. Now, it's important to note that these barrier methods, while effective, are not foolproof. Their effectiveness largely depends on correct and consistent use. Also, they may not be suitable for everyone due to potential allergies to materials or discomfort during use. Barrier methods are widely used due to their simplicity and non-invasive nature. They provide an accessible option for many people looking to prevent pregnancy, without the need for hormonal intervention or invasive procedures. Now let's move on to hormonal methods. Hormonal methods work by regulating a woman's hormones to prevent ovulation. They function primarily by releasing hormones such as estrogen and progestin into the body, which in turn prevent the ovaries from releasing eggs. This method also thickens the cervical mucus, which makes it difficult for sperm to reach the egg. Let's dive into some of the most common hormonal methods. First up, we have birth control pills, also known as the pill. The pill needs to be taken daily at the same time to maintain a steady level of hormones in the body. It's a highly effective method when used correctly, with a failure rate of less than 1%. However, it can have side effects like nausea, breast tenderness, and changes in menstrual flow. Next, we have the birth control patch. It releases hormones through the skin into the bloodstream. This method is as effective as the pill, but it only needs to be changed weekly. Side effects can include skin irritation at the site of the patch and similar side effects to the pill. Injections, or the shot, is another hormonal method. It involves receiving a shot of hormones every 3 months from a healthcare provider. It's highly effective, with a failure rate of less than 1%. However, it may cause side effects like weight gain and irregular menstrual periods. Lastly, we have implants. These are small, thin rods that are inserted under the skin of the upper arm. They slowly release hormones into the body over 3 years. The implant is one of the most effective methods, with a failure rate of less than 1 in 1,000. Side effects can include irregular bleeding, mood swings, and weight gain. Hormonal methods offer a higher level of effectiveness. They're a reliable choice for many, but it's important to remember that they don't protect against sexually transmitted infections. Always consult with a healthcare provider to choose the method that's right for you. Next, we will talk about intrauterine devices. Intrauterine devices and sterilization methods provide long-term or even permanent solutions for family planning. Let's delve into intrauterine devices, often shortened to IUDs. These small T-shaped devices are inserted into the uterus to prevent pregnancy. There are 2 main types: hormonal and copper IUDs. Hormonal IUDs release progestin, a hormone similar to progesterone, into the uterus. This thickens the cervical mucus to prevent sperm from reaching the egg. Copper IUDs, on the other hand, release copper into the uterus, which is toxic to sperm. Both types of IUDs are highly effective, with less than 1% of users experiencing an unintended pregnancy in the first year of use. They can be left in place for several years, with hormonal IUDs typically lasting 3 to 5 years, and copper IUDs often effective for up to 10 years. Side effects can include irregular menstrual periods, spotting between periods, and cramps or pain during insertion. Now let's talk about sterilization methods. For women, this typically involves a procedure known as tubal ligation, often referred to as having your tubes tied. This procedure permanently prevents the egg from traveling down the fallopian tubes, and hence prevents fertilization. For men, vasectomy is the equivalent procedure, where the vas deferens, the tubes that carry sperm, are cut or blocked. Both procedures are highly effective, but they are considered permanent, so they're typically recommended only for people who are certain they do not want more children. Side effects can include discomfort at the surgical site, and there's a very small risk of complications from surgery. For vasectomies, there may be temporary swelling or bruising. For tubal ligation, there's a small risk of damage to the surrounding organs during surgery. These devices and methods are suitable for people who are sure they do not want more children. Now, let's wrap up. We've covered a lot of ground on family planning devices. It's time to summarize what we've learned. Barrier methods, including condoms and diaphragms, provide a physical barrier to prevent sperm from reaching the egg. While they are easily accessible and have minimal side effects, their effectiveness can vary. Hormonal methods like birth control pills, patches, and injections work by regulating hormones to prevent ovulation. They are highly effective, but may come with side effects such as mood changes or weight gain. Intrauterine devices, or IUDs, are long-term methods that can be hormonal or non-hormonal. They are extremely effective and can be reversed if you decide to have children in the future. Lastly, sterilization is a permanent method of family planning. It's highly effective but irreversible, so it's a serious decision to make. Remember, choosing the right family planning device depends on your personal circumstances and future plans. Consult with a healthcare provider for personalized advice. Subscribe for more informative content like this. Thank you for watching.